Congress, your staff members of Congress, as well as many members of Mom Congress are here with us today, and want to also say hello to those watching live through our Instagram feed. Welcome again to today's briefing titled Saving and Supporting Moms. Welcome also to the federal agencies in the room. We're grateful that you're here as well. Mom Congress is the organization sponsoring today's briefing, along with several partners, which we're grateful for. And our mission is to address the most pressing issues facing U.S. mothers. These pressing topics will be discussed today and include maternal health and mortality, maternal mental health, childcare, and paid leave. This briefing is the start of our Hill Day, or our fly-in, where nearly 100 mothers have traveled from around the U.S. to share their stories and advocate for the bipartisan bills in the bill package that we call the Mom's Agenda. And mothers in the room today, if you could please wave your hands and say hello. We are so grateful that you're here to advocate for change. We believe and know that both Republicans and Democrats are fighting for change for mothers and their families right now, and we're grateful for that. And we believe that support and infrastructure for mothers and their families are absolutely critical. Struggling mothers can't serve their children nor America well, while thriving mothers are the bedrock of a stable and thriving America. And with that, we have two members of Congress here to make remarks and welcome all of you to today's briefing. And I'd like to welcome first to the podium Representative Robin Kelly. Congresswoman Robin Kelly represents Illinois' second Congressional District. She's a member of the House Energy and Commerce Committee and is deeply committed to improving the health and wellness of vulnerable communities across the country. The Congresswoman serves as leadership of several caucuses, including the Caucus on Black Women and Girls and the Bipartisan Maternity Care Caucus. Congresswoman Kelly, welcome to the podium.
Good morning, Mom Congress. I am impressed. All these people in the room this early, and it's a little hot. All that brain power. It's an honor to join you today. I want to thank Central Road Solutions for hosting this critical briefing on maternal mental health. I'm proud to stand with Congresswoman Young Kim as co-chairs of the Bipartisan Maternity Care Caucus to find common sense solutions to support moms and babies. Despite what you read or think, we do get along better than people think. We do pass bipartisan bills. We need more people to stand with us in this fight. When I got to Congress, I didn't realize that it was more dangerous for my daughter and stepdaughters to have a baby than it was for me. And my baby is 41. That's why it's so important that we continue to educate our colleagues and constituents about the importance of improving mental health care in this country. And mental health conditions are the most common complication of pregnancy and childbirth and impact at least 1 in 5 women. In my home state of Illinois, 40% of pregnancy-related deaths are caused by mental health conditions. We need to support resources like the National Maternal Mental Health Hotline and screening for maternal depression. These initiatives are so important because when our moms do better, we all do better. Thank you to everyone who has joined today for this briefing. This is especially important to me. Besides being a mom and a grandmom, I have my master's in counseling and we used to work on the mental health unit, so I know how very important this is. And we all need to work together to ensure our moms get the care they need. And thank you again. Thank you for your interest. Thank you for all your hard work.
Thank you so much, Representative. I'd like to now introduce Representative Ashley Hinson. Congresswoman Ashley Hinson represents Iowa's 2nd District, also the 2nd District in Congress. She's a member of the House Appropriations Committee, where she works to ensure every taxpayer dollar is spent responsibly, and her policy is focused on pro-growth strategy, including supporting families and mothers. She has introduced and supported bipartisan legislation to improve child care, which we're going to be talking about today, and also introduced a comprehensive pro-family agenda. Representative Hinson, we're so glad you're here. Thank you. Well, thank you, everybody. Hopefully everybody's caffeinated and ready for your Hill Day. And hopefully many of you moms get a little break too while you're here, right? We all need that from time to time. But I just wanted to say thank you for coming out and taking part in this briefing and coming to talk to your elected representatives. It is so important that whether they're moms or dads or don't have kids, right, that they hear from you directly about how important these policies are. As a mother of two, my boys are 10 and 12 now, and boy, they're trying to eat me out of house and home, I can tell you that. But I understand how important it is to have pro-family, pro-growth policies, that moms have access to maternal health care, that we have paid leave options for families, and, of course, child care. Health resources as well. And as a representative of rural Iowa, I know that many times a lot of those resources are really hard to come by because people are disappearing from rural areas, right? And we want everybody to have that same access to those resources no matter what their zip code is. One area that I am particularly focused on is ending the tragedy of stillbirth. When a mother tragically loses a baby after 20 weeks of pregnancy, that mother has endured what it feels like to be an expectant mom and go through all of those emotions. So when Robin talks about the mental health associated with that, that is a huge impact when you're dealing with stillbirth. So I introduced the Maternal and Child Health Stillbirth Prevention Act. This is designed to help improve data collection, research, support for families who've experienced this just heartbreaking loss. And many of the women who are involved in the Stillbirth Prevention Act are going to be here on the Hill today, so I'm excited to hear from many of them as well. I introduced legislation to designate today, September 19th, as National Stillbirth Prevention Day, so again, trying to draw awareness to that. The women who endured a stillbirth are the strongest women I know. I've heard many of their stories. I've heard their pain. And I want to make sure as many moms as possible don't have to undergo that fight. So we're going to make sure that we try to keep education on the forefront and educate as many women as possible. To talk about access to care, I've also introduced the Midwives for Moms Act. This will expand access to midwifery services for expecting moms. Many women in rural communities may not have access to an OBGYN. So we need to make sure we're helping to bridge that gap, provide exceptional care for our moms in maternal health care deserts. And there are a lot of them, not just in my district, but around the country as well. So my goal is to have as many healthy moms and healthy babies as we can in this country. So thank you to Mom Congress for helping facilitate such a meaningful conversation with all of you today. I'm looking forward to hearing what you all have to say. I'm sure you have some great panels and some great experts coming before you today, and we'll have a lot of great policy discussions. So thank you for the opportunity to represent Iowans and lots of moms in Congress. Thank you so much.
Thank you so much, Representative Hinson, and we really know that we can count on your leadership and leadership of others in Congress, and we're very impressed that you're managing being a member of Congress and raising two kids at home. So thank you on behalf of all of us for being here and raising your kids at the same time. Really appreciate it.
They need to see what a strong woman looks like.
Thank you. All right, are you ready to get started, Mom Congress? Yes. Let's do this. I am really excited to introduce an exceptional panel today. One of our members speaking today is a return member to our panel, our annual Saving and Supporting Moms briefing. I'm going to introduce all of our panelists first, but the first representative is Shanna Cox from the CDC. Shanna Cox from the CDC. Shanna serves as the Associate Director for Science for the Division of Reproductive Health in the Centers for Disease Control and Prevention, the CDC. Mrs. Cox is responsible for the division's reproductive health portfolio, scientific portfolio, and data portfolio, and has published extensively on pregnancy-related deaths and complications, contraception access, mental health, and substance abuse, and more. She is an agency expert in health equity and healthcare services research, and we're going to hear quite a bit about her published research here in just a moment. And then I also want to welcome Kay Mathews from the Shades of Blue Project. Kay is the founder of the Shades of Blue Project, a nonprofit. She and her team are on a mission to provide
those who are pregnant and then in the postpartum period with care, respect, and the dignity they deserve regardless of their social status or birth outcome. It is from Kay's personal experience of infant loss and postpartum depression that she first recognized the critical diversity gap in mental health resources and emotional support for Black and minority women and other birthing individuals and their families. She and the Shades of Blue project are on a mission to address these gaps both locally in Houston, Texas, and through federal policy. Today she'll be sharing more about the state of maternal mental health here in the U.S. and in her community. And next I'd like to say welcome to Lauren Hipp from Moms Rising. Lauren leads the state and national early learning campaigns for Moms Rising, a nonprofit organization. She has a passion for developing policy and programmatic solutions driven by the impacted communities those policies seek to serve. In her prior role, she directed a philanthropic cross-issue policy and advocacy portfolio to advance early childhood mental health and maternal mental health at the state and national levels. She has also led the policy and community partnership efforts on early childhood in Washington State. Today she'll be addressing the urgent need for the U.S. to address child care solutions at the end of this month and on an ongoing basis. And next I'd like to say hello and introduce Ben Gitis from the Bipartisan Policy Center. Mr. Gitis is an Associate Director for Economic Policy at the Bipartisan Policy Center. At the BPC, he leads initiatives on workforce and paid family leave. He also served in several prior roles, including as the Director of the Labor Market Director of Labor Market Policy at the American Action Forum, where he researched and wrote about paid family leave, among other issues. While at AFF, Gitis was also a member of the Brookings Institution Working Group on Paid Family Leave. He's been featured in many major media outlets, including the Wall Street Journal, the Washington Post, the New York Times, and Associated Press. And next, I'd like to say hello and welcome Dr. Dana Susskind from the University of Chicago. Dr. Susskind is an MD and the founder and co-director of the TMW Center for Early Learning and Public Health, and a professor of surgery, pediatrics, and public policy at the University of Chicago. She has dedicated her research and clinical life to optimizing foundational brain development and preventing early cognitive disparities and their lifelong impact. And she knows that mothers are play a critical role in forming those solutions and supporting their children. She is also the author of 2 best-selling books, including a book that I can't wait to get my hands on and read in full called Parent Nation: Unlocking Every Child's Potential, Fulfilling Society's Promise. She's a member of the American Academy of Pediatrics and a fellow for the Council on Early Childhood. And her work has also been profiled by numerous media outlets, including the New York Times, The Economist, Forbes, NPR, and Freakonomics. Welcome to all of you. We're so glad you're here. And now I'd like to invite Shanna up to the podium.
Good morning. Good morning. Thanks so much for that great introduction. So thank you so much for your time today, coming out early, supporting this work, and I'm really excited to share with you what CDC has underway to eliminate preventable maternal mortality and increase equity in maternal care and outcomes. So CDC has been working to get better data to understand and prevent maternal mortality. We often present on our maternal mortality review committees, or MMRCs, as these efforts represent the most detailed, complete data on maternal mortality. However, this is still relatively a new activity at CDC. We only got our first appropriation to start this work in the fiscal year 2019, but the program has grown rapidly, expanding from 24 awardees in 2019 to 44 states and 2 territories in 2023. In addition to the growth in the number of states, CDC has made progress to improve the process of maternal mortality, such as increasing the timeliness of review, We've had a 14% increase in the percentage of pregnancy-related deaths identified within 1 year of death among funded recipients. Also at the state's request, we've added fields and definitions to capture things such as discrimination and racism, and to be able to link community-level indicators to better understand and address the drivers of maternal mortality. We've also been working very closely with states to disseminate data at the state level for data to action. These recommendations from the maternal mortality review committees have included policy-related solutions, such as the expansion of pregnancy-related eligibility for Medicaid to 1 year postpartum, support for networks of substance use and mental health care, and contributing factors such as the lack of awareness of urgent maternal warning signs and patients' concerns dismissed due to patients' race, gender, or weight. And we've also put resources into developing tools such as our state strategies for preventing pregnancy-related deaths, which really helps walk through the process of identifying goals and strategies to address maternal mortality. It highlights a range of approaches such as paid family leave, risk-appropriate care, and ensuring respectful, patient-centered care for all women. And so this program really has the potential to highlight an aggregate picture of pregnancy-related deaths at the national level. Here I'm highlighting data that we released last year from 36 states, where we've demonstrated that 84% of pregnancy-related deaths are preventable. Over 50% occurred from 7 days after delivery to 1 year postpartum, when women are in the community and really need support. And there are differences in the underlying causes of death by race ethnicity. So for example, cardiac and coronary conditions are the leading cause of pregnancy-related deaths among non-Hispanic Black people, whereas mental health conditions, which include suicides and overdoses, are the leading cause of death for Hispanic and non-Hispanic white people. We also learned that hemorrhage was a leading cause of death for non-Hispanic Asian people. So this is why that disaggregation of the data really helps us understand where we need to focus our efforts to address disparities. And so we released a new CDC Vital Signs on August 22nd on respectful maternity care. This topic was chosen because a lot of the data that we were getting from review committees and partner work were really showing that this was a gap. We really have to share the message that the standards of quality maternity care include respectful care. So the WHO defines respectful care as care that's organized and provided to all women in a manner that maintains their dignity, privacy, confidentiality, ensures freedom from harm and mistreatment, and enables informed choice and continuous support during labor and childbirth. And so we examined maternity care experiences across 3 components: experiences of mistreatment, and examples of that would be violations of physical privacy, ignoring requests for help, or verbal abuse. Experience of discrimination. We asked whether women experience discrimination due to their race, ethnicity, or skin color, age, income, or weight. We also asked women about their reasons from holding back from communicating with their healthcare providers around questions and concerns they may have. So we analyzed data from a Porta Novelli View Mom survey. It was administered in English from April 24th to 30th of 2023. This is an opt-in consumer audience panel survey of moms 18 to 67 with children under the age of 18 living at home. Respondents for each survey are selected from those who have volunteered to participate in online surveys and polls. We asked about socio-demographic information such as age, race, ethnicity, educational attainment, health insurance during delivery, and then also the maternity care experiences during pregnancy or delivery of their youngest child, including satisfaction with care, experiences of mistreatment and discrimination, and again, whether they held back from asking questions or discussing concerns with their providers. So this is a quick summary of the characteristics. About 40% were 30 to 39 years old. Most had a child 5 years or older, 70% white, about 11% Black, Hispanic, 5% Asian, and then 3% American Indian, Alaska Native, or Native Hawaiian Pacific Islander. About 60% were privately insured at the time of delivery and about 33% insured by Medicaid, and most were satisfied with their care during delivery. But when we asked specific questions about mistreatment, we found 20% of those surveys reported mistreatment during maternity care. And the most common types of mistreatment were things like receiving no requests to responses for help, being shouted at or scolded, not having their physical privacy protected, or being threatened with withholding treatment or made to accept unwanted treatment. We found that these experiences were more frequent among Black, Hispanic, and multiracial persons, where about 30% experienced mistreatment. We also saw that these experiences varied by insurance status. Women with no insurance or public insurance reported more mistreatment during maternity care than people with private insurance. When we asked about discrimination, about 1 in 3, 30%, experienced discrimination while getting maternity care, and that frequency was about 40% among Black, multiracial, and Hispanic mothers. The most common reason for discrimination were age, weight, and income, but these reasons varied by race, ethnicity. For example, Black respondents, their most common reasons were weight, race, ethnicity, or skin color, and age. Among multiracial persons, their most common reasons were age, differences in opinion with caregivers about the right care for themselves or their baby, race, ethnicity, or skin color, income, and substance use. And among Hispanic persons, the most common reported reasons were age, weight, and income. And unfortunately, almost half, 45% of women reported holding back from asking their questions or discussing their concerns with their healthcare providers. The most common reasons were thinking or being told that what they were feeling was normal, not wanting to make a big deal about it or being embarrassed to talk about it, thinking that their healthcare provider would think they're being difficult, that their healthcare provider seemed rushed, or not feeling confident in that they knew what they were talking about. So really, this is the data, but really wanted to highlight what can be done. So to improve respectful maternity care, we need to work at multi-levels, including the health systems, providers, patients, and communities. Health systems, with the help of perinatal quality collaboratives, can implement quality improvement initiatives to standardize the care and support providers with training on discrimination, stigma, and unconscious bias. They can also work to hire and retain greater diversity in their workforce and encourage patient communication and support through doulas and midwifery models of care. We also have health communication campaigns such as Hear Her that can enforce community engagement and include the perspectives of patients, families, and communities to raise awareness to incorporate the components of respectful maternity care. Healthcare professionals also play a role by providing respectful patient-centered care to facilitate managing chronic conditions, have ongoing conversations about the urgent maternal warning signs, and provide timely treatment when problems arise. By engaging patients, this can lead to improvements in safety, quality, and satisfaction. Family members and support systems of pregnant and postpartum women can listen to their concerns and help them recognize the urgent maternal warning signs. They can also encourage women who are pregnant and postpartum to seek medical help if something doesn't feel right and attend medical visits with them. So while maternal mortality review committees can identify the prevention recommendations, at CDC we're supporting perinatal quality collaboratives to implement population-based quality improvement to address the drivers of pregnancy-related deaths. These organizations play a critical role as they're on the ground and enact change on a facility-level basis with the focus of achieving population-level improvements. In fiscal year 2022, CDC expanded support to 27 states from 13 states, and we also support the national network of PQCs. A key focus of our work is achieving equity in care and outcomes, and 9 of the currently funded PQCs have their primary initiative focused on addressing respectful care and birth equity. And just last week, we announced funding for an additional 9 state perinatal quality collaboratives using fiscal year 23 dollars. Another cornerstone of our activities that has grown rapidly in recent years is the Hear Her campaign. This campaign was launched in 2020 as it shares potentially life-saving messages about the urgent maternal warning signs, encouraging women to trust their bodies, and prompting support people such as family and friends to help them get the care they need. The provider component of the Hear Her campaign emphasizes the importance of listening to women and providing respectful care. These images are from a newer segment of the Hear Her campaign that was launched last November in partnership with HHS Office of Minority Health to better reach and serve American Indian and Alaska Native communities. While much work remains, we are better positioned to learn and understand the drivers of maternal mortality and opportunities for prevention. So with that, here is my contact information, and look forward to the discussion and questions at the end. Thank you.
We have some more seats up front. Folks that want a seat, welcome. We're so glad you're here. There's one here and a couple in the middle here. Folks can squeeze in for our members of Congress.
I have a question on the email. Is that a G or a Q?
A Q.
A Q. A QBOH.
Folks want to come up? You're welcome to come up. We know it's a little tight in the back. Maybe raise your hand if you have a seat next to you so folks can please welcome.
So good morning, everybody.
Good morning. Good morning.
Good morning.
Good morning.
I can't talk about mental health if y'all don't give me what I need so I can give y'all what y'all need, right? So energy is what you're going to need to make it through this day. So I want to implore you to, one, make the commitment to yourself right now that you're going to find at least one thing that is going to motivate you to keep moving forward. So that's the commitment that you make to yourself. We're already committed to this work because we're in this room. But what is the commitment to yourself? So make one thing that you need for yourself out of today and to continue to do this work. And so, of course, as a community member, my presentation is going to be focused just on that, maternal mental health in our communities. And so as an overview, maternal mental health refers to the emotional and psychological well-being of pregnant individuals, new mothers in the postpartum period. It encompasses a range of mental health conditions and challenges that can affect women during pregnancy and in the time period after childbirth. Not necessarily a year. It can go beyond a year. So after childbirth. I want to be real clear on that. I always think it's important to share how we are looking and referencing maternal mental health right now. I personally use maternal mental health. So there's perinatal mental health. There is a plethora of things in which words that we can use that are related to maternal mental health. For me, it's important to use verbiage that I am constantly using out in my community. I don't want to switch it up, because if I'm just now getting you to focus on your mental health, I don't want to start saying perinatal. It's important, but you honestly have to be able to craft these things towards the folks that you are serving, always keeping that in mind. And so we're going to be community centered. We have to think about those things. Postpartum depression is something that we always hear, but sometimes get confused with postpartum psychosis. I have to always give that reference because, believe me, no woman wakes up one morning and decides to kill all her children. There's a time period in which this happens over time, and we typically miss the warning signs in the beginning. It doesn't just, it escalates. It gradually happens sometime over time. And most oftentimes we do recognize it. We see it, but we don't know what to do. And so as mothers, as birthing individuals, as those of us who are out here advocating, we also have to know what we need to know in order to, when we do recognize there's a problem, if we are not the right ones, because we're one individual or 2 or 5 or 6 or 10 of us, sometimes it takes 25 of us to know, and that 25th person will be the one to be like, no, that's what this is. But understanding that there's no one size fits all to this, and also being very familiar with the language, because what I know 100% is if you're having a conversation around postpartum depression, and yes, I may be experiencing postpartum depression, but if you don't say one thing that makes me see myself in that verbiage, I think it's not me.
Yeah.
And so we also have to understand that piece. Talking out loud, we can no longer talk behind closed doors. That's not working. And I really honestly don't believe that women necessarily suffer in silence. I think we suffer out loud, but there's no one to actually recognize it or to say, girl, I see you. Let me help you.
Yes.
So changing language, like we've been doing this, I've been doing this work for a decade now. And some of the same things that I heard back then, I'm still hearing today. And I'm like, no, we're a lot further along than that. But if we keep using that language in that way, it'll be a continuum, another decade from here. So keeping that in mind, like we want to break stigmas. We also got to break those things that we're so used to saying because it feels comfortable and we keep hearing it. Like changing the narrative is what's going to be most important for us as we do this. Because I always say, I serve the community because I am the community.
Yeah.
I have been someone who has sat across somebody's desk and they told me I made 73 cents too much to get assistance for a temporary situation that could have turned into a long-term situation because I needed help in a moment. And so we have to think about that when we serve community. And so community is not just a word that should be thrown around. You got to think about, these are real people with names, not numbers. We count the people that we serve because we know their names. So it's not like 10 people came in, oh, it's Shanna came in, Miss Liz came in, you know, we get to 10 in that way. So when we serve the community, we are 100% intentional about what that looks like. And so we cannot continue to be in 2023. COVID is going to be something that is a huge part of who we are moving forward. But the impact of COVID-19 on the maternal mental health space has been very detrimental. So many people before were struggling, and then COVID-19 came and wiped a lot of things out, sent a spiral of effects within our community. And yes, we were all navigating it because the world shut down, not like a state of here or two. The entire world shut down, and so did people. And so what we are seeing out here now is folks getting acclimated to being back outside. Anxieties are still high because I'm still meeting people that I met during the pandemic in person, and it's weird. It's like, oh, I don't know you outside that screen. Like, come a little closer, you look a little different. Oh, your hair is cute. Like, I love that. But that's what COVID-19 did with us. So we're really honestly acclimating ourselves, because also what COVID did is it introduced a lot of us to our mental health. When we could get outside and go away and get a break from home, that was no longer an option. So what were we to do? A lot of us had to sit in that and still navigate what that looks like. And so now that we have an opportunity to get back and engage with folks, it's still difficult. As someone who just finished putting on a conference in July, I definitely saw the social anxiety happening. But I was also intentional about curating a space where if you need a break, there's a room over there for you. If you need to step outside, get some fresh air, all of those things that we have to think about for other folks. Because the pandemic, the post-pandemic era is still here. It's not going anywhere. And we do have to understand that. We can't let it stop us, but we do have to understand that. And so when we are serving and looking from the perspective of the community, the financial instability that COVID caused, my God. People are still reeling from those effects and what happened and how their finances either declined or up. Because some people were, what do they call them? No, the people who were, their position at in the job place, it was the essential workers. The essential workers. My husband was an essential worker as a truck driver. I didn't want him to be. Because we had to go through the steps of the taking off your clothes in the garage, couldn't come into the house, all of those steps that medical professionals, so all the essential workers, just think about not getting a break. Like the world shut down. You think, oh, the world shut down, I'm about to get a break. Everybody didn't get that break. And so as we move through what that looks like, those essential workers who still have to show up, somebody was feeding us during that time, right? So you have the restaurants, you have somebody in the grocery store, all of those essential workers. Financial instability became an issue because what if I didn't want to go to work? What if I didn't want to be exposed to COVID? What that looks like, what that feels like. But if I have children, who's going to watch my child if you got me working 12, 14-hour shifts? So there became a real financial instability during the COVID-19 era that people are really still working to recover from. The increase in mental health service requests, as a direct service provider, we see that. The increase came from, again, people being introduced to that mental health. I never struggled with this before now, and now I find myself either not wanting to go outside or just simply really walk away from all my responsibilities. Like I literally woke up that way. Of course, we know the mortality morbidity increase, as we saw with her presentation, continues to tell us that we have this issue. Decreased social interaction is what I talked about. Social anxiety is a good way to say that. We are literally struggling to get back into this is the new norm. We're not getting back to normal. There's no more getting back to normal. We have to continuously tell our moms that there ain't no going back. We got to keep moving forward and seeing what that new play looks like. As someone who lives in Texas, we know Roe versus Wade impacted women's health in such a huge way. In Texas, we had SBA. So Roe was already overturned in Texas. We were already struggling. And so the effects of SBA for us, we've already seen. Our intake has tripled by 3 times because who really knows that they're pregnant before 6 minutes? Before 6 weeks. I mean, is that realistic? And so you send women into a different circle of life that they now have to figure out and navigate. And so who's going to take up that slack? Community organizations. So of course our maternal mental health needs have simply increased because of this, and we'll continue to see that. One thing that impacts, you don't ever actually see the real true impact till about 2 or 3 years down the line. So imagine where we'll be in 2025 or 2026 with this conversation. But it's imperative for us to think about that now and to look at that. And before I take my seat, community voices are important because we have something to say. We are the ones that are being impacted by these numbers. These numbers, again, are tied to real folks. Listening to who we are and not just propositioning us in a way to say what we're doing and how we're serving. It's extremely important to listen to what is being said, or what's not being said is more important. Body language, the energy that people, it's about compassion. When you're talking about respectful care, we should have already been getting that. Why are we fighting for respectful care? It should be an automatic given. What are we doing? Yeah. Right. And so when we think about community voices, every person that you serve, you need to look at that person. You need to make a connection because there's no one-size-fits-all approach to any of this, but we can certainly learn how to serve people on an individual level. Where if there's a room full of 100 people, I should see 100 individual people, not 100 people as a whole. Thank you.
I'm really grateful to be with you all today. As Joy mentioned, I'm with Moms Rising. We're a national grassroots organization, online and on the ground, with members across the country, and we hear from people every day about how the childcare crisis impacts their families. And I'm sure that you all in your home states and districts and communities have heard the same story too. And that's really demonstrating the fact that childcare is in crisis and that this is not an epidemic of personal failings, right? It is not an individual problem. It's not your fault that you can't find childcare, that you can't afford it. It is a systemic issue, and we have the opportunity to solve that with policy and with funding. So to just start at a real basic level, childcare is fundamental to many things, and it's fundamental to our shared values of family and of community. What could be more important to American communities than how we care for our children, right? How our children are thriving matters to us all, whether or not, if we have kids or not. Families across all income levels, across all backgrounds, share the same determination to provide a foundation for their children for them to thrive, right? We want our children to do better than we did. And that is shared across the country in every community. And I think that points to the fact that early childhood and childcare are linked to the fact that, and you're going to hear this from Dr. Suskin in a minute, but is this incredible time of life. It is unparalleled in the amount of growth and development that children experience. And it is our responsibility as the adults to really provide for that, right? What are the inputs that we're allowing for children to be able to take off during this period? And that matters how we treat mothers and families, because we know that's inextricably linked to how children are doing. And it matters about the opportunities that we put in front of them, which often includes childcare. Childcare in this country is a public good, and we need to treat it that way. Just like the clean air and safe food that we enjoy, and schools and libraries in your local communities, access to affordable childcare is a public good, and it is a matter of a national priority that benefits all of us. So it's also fundamental to our economy, right? 2/3 of children birthed to age 12 have all available parents in the workforce. And we know that many more parents would join the workforce if good childcare were available to them. 72% of moms with children under 18 are in the workforce. That points to a huge need for childcare. Parents can't work if their childcare isn't working for them. And right now it's not working for them. And that creates an economic time bomb for us. Access to affordable childcare is both job creating and job enabling. So I want to talk about childcare policy at a glance, just like where we're at right now. What do we mean when we talk about childcare? Because we know that childcare happens in a lot of different places. Typically, in this context, we're talking about the provision of care for children up to age 12 in settings that include in-home childcare centers, or family, friends, or neighbors. And right now, childcare is funded in a lot of different places, right? Federal, state, local, private pay. And that's created this patchwork system of care that frankly is not working for families, it's not working for providers, and it's not delivering for our communities and our economy. The largest source of federal funding, right, is this Child Care and Development Block Grant, which you all probably know a lot about. And this funding goes into the states, and states can use this funding for specific purposes related to the provision of access to childcare in communities. And that looks like things like childcare financial assistance and programs to support childcare providers and program quality. And this idea of federal funding is really important, right? It's important to states because they need a partner in this. They can't do it alone. Childcare is an expensive endeavor. I know we hate to say that, but it is, and it should be, right? This is about the care and keeping of our children and preparing them for what is in the world for them. And we need to have a real partnership in that across our federal and state entities. It's also important to ensure equitable access and affordability to all families. It's important that we ensure a level of consistency in infrastructure so we can support quality programming and we can support our early childhood workforce. That requires a lot of federal attention and investment because it's with this system that we can really recognize and serve childcare as the public good that it is. So what does childcare look like today? I think you all really know the answer to this. Childcare is really hard to find and it's incredibly unaffordable. It costs more than tuition in a majority of states, including my home state. The majority of families live where childcare is hard to find. We often call that a childcare desert, right? There are long wait lists. Lack of match to family needs. It's simply out of reach. And this disproportionately impacts the ability of mothers to participate in the labor market. That becomes a family economic security issue and a gender economic security issue. Additionally, the childcare workforce is undervalued and underpaid, and women, and disproportionately women of color and immigrant women, make up 94% of those providers. And poverty wages, not surprisingly, plague the field. In my home state of Washington, childcare workers make less than pet groomers. We are talking about a field that is significantly underpaid for the amount of responsibility and care and compassion and experience that is required. And we know that childcare workers then struggle to make ends meet for their own families and quite often have to rely on public assistance. And that's unacceptable. State and federal policies are really failing to fix this broken system. Only 1 in 7 eligible families are actually receiving federal child care subsidies. Child care subsidies also fail to cover the true cost of a quality program, right? that further impoverishes women and women of color. And the childcare crisis is, of course, compounded by the lack of pro-family policies in this country, including gender-based pay inequities and the lack of federal paid leave. So there's a real cost to this crisis. Like, this is a choice, and we are here. And let's break this down a little bit, right? Like, let's think from the positive angle, thinking about how much childcare could provide for a child. We know from research, we know from being parents ourselves, that setting the foundation for children to thrive through early childhood experiences is an incredible opportunity. If we provide that, we know that we can see dividends down the line in all kinds of social and health outcomes for children and for our society. For families, I think the cost of this is pretty clear, right? If you think about cumulative stress and how that impacts mental health, that is an incredibly important part of this. Childcare, we know from data and from research, impacts the mental health of families because it is so hard to find and afford, and constantly having to think about how are you going to make that payment, how are you going to keep your kid in care, how are you going to make this choice between work and care for your children is incredibly hard and impacts the mental health of mothers, of families, and we know that that is then linked to how well our children are doing. Obviously, it impacts the short and long-term family economic security of families. Too many parents, and mostly moms, are pushed out of the workforce due to the lack of childcare. And you can look at this in terms of numbers. These are numbers from the Bipartisan Policy Center. 56% of parents report childcare impacted their decision to accept a job. Like, this is not, we all know this. We talk to people every day who make these decisions. 30% of parents report childcare impacted their decision to leave the workforce. These are huge economic impacts, not only for the family, but for our communities and our economy in general. Now, I have a picture of a pie. Pie's obviously delicious. This is an awesome picture, but it's also because there is enough pie for all of us. We can all have a slice of a pie, right? We have an abundance of wealth in this country, and there is enough to be able to provide for high-quality childcare for all children and families. We lose $122 billion a year in economic productivity and revenue losses due to childcare. But if we ensured childcare for families, that could add 2.2 million jobs to the economy and increase our GDP by $274 billion. So what now? We have voters behind us. We have all of this data and research, and we have two opportunities in the immediate and the long term. The immediate is there was pandemic-era funding that helped to sustain the field and prevent it from total collapse during the pandemic. That was huge. And studies from CLASP and other sources show that states use this to really help and support families and providers during this time. That is about to end at the end of this month. That could send 3.2 million children out of childcare. This is a moment where we need to invest and think about how do we stabilize our communities and provide a stopgap for our economy. Second is we need to think about long-term comprehensive solutions for childcare. This is about thinking about what works for families, how do we support providers in the early childhood workforce, and how do we support our overall economy. And I believe that we can do this together. We have the smarts, we have the data behind us, we can do this, and I look forward to working with you all. Thank you.
Hi everyone, thank you for having me here today. My name is Gitis and I'm at the Bipartisan Policy Center and I lead our work on paid family leave. And so I was asked here to talk about kind of the state of paid family leave today and politically, and then what does it mean for workers and families. So first, as I'm sure you all know, the United States is the only developed country in the world to not guarantee a paid family and medical leave benefit, and over the last 10 years there's been increasing bipartisan interest in changing that and providing more access to paid family leave across the country. And so this is culminated in the House Bipartisan Paid Family Leave Working Group launching earlier this year, which we've been working closely with. It's co-chaired by Representative Chrissy Houlihan from Pennsylvania and Stephanie Bice from Oklahoma. And they have been holding a number of educational meetings and hope to chart a bipartisan path forward on paid leave. And so why is this a bipartisan issue? Well, there are a few reasons. First off, the sad reality is that 1 in 4 new moms go back to work within 2 weeks of giving birth. This is a really terrible situation for the health and development of children, the maternal health outcomes, and as I'm sure you know, and from what you'll hear from Dr. Suskin, is that those early weeks of after giving birth are vital to the health of a newborn child. Only 25% of workers today have access to paid family leave from their employer, and so a large majority of folks either have to pull together other types of paid leave benefits, leave their job, or go back to work way too soon. The leave your job aspect of this is what has driven kind of a lot of the bipartisan interest, because today we face a significant labor shortage with essentially 8.8 million job openings and very low unemployment and labor force participation that has been declining for 2 decades. And many see paid family leave as a potential solution to helping get more workers into the workplace. And so at Bipartisan Policy Center, we recently released a poll with Artemis Strategy Group to understand what is keeping folks out of the workforce and the role that paid family leave could play in helping them return to work. And who we specifically polled were prime age adults, those under the age of 54, who are not working. This includes folks who are considered out of the workforce entirely, meaning they're not looking for work, and also includes folks who are unemployed, meaning that they are not working but are looking for work and desire a job. So about 85% are the folks who are out of the labor force, and is the main focus of the poll, but includes a small sample of folks who are unemployed as well. And here's what we found. So we asked the question of what is the main reason you're not employed. In this chart, you'll see the blue is folks who are out of the workforce, meaning those are the folks who are not looking for work, and the red is those who are unemployed. And 7 in 10 said that a caregiving reason or a personal health reason was why they were not working. It was the main reason. It's relevant because those are the 2 issues that paid family and medical leave is designed to help offset and help folks balance their personal health and caregiving needs with being able to hold on to a job. Notably, only 3% cited that difficulty finding work was a reason that they're not working, meaning that for those who are out of the workforce, meaning that there aren't really that many what's referred to as discouraged workers in today's economy, where folks aren't looking for work because they've given up. So it's really, for the question of how do we get workers back to the workforce, it's about tackling caregiving and personal health and giving folks the tools they need to go back to work. The next big question we asked was, and big finding we had was, what was the number one most important benefit that would help folks return to the workforce? And we asked a wide range of benefits and working conditions. And what we found was that paid family leave and flexible work arrangements were essentially just as important as compensation. And so I found that to be somewhat surprising, because you think for a lot of folks going back to work, it really comes down to the bottom line of how much are you going to get paid. But what this shows is that for this population, it's really about giving them the tools that they need to be able to balance, attending to their children, their own health, an ill family member. And so 15% that said that paid family and medical leave was the number one most important benefit. 16% said it was compensation was the most important thing. And then 19% said that is flexible work arrangements, so the ability to either work remote or have flexible hours. We also talked about, we also asked about a little more specifically about the different components of paid family and medical leave and how that would impact ability to work for these folks. So specifically for those who were not working because they were caring for children, about 40 to 50% said that they would have likely stayed in their last job had their employer offered a parental leave benefit, meaning paid leave directly following the birth of a child. And then 45% say that they would be much more likely to return to work if a future employer offered them that benefit. About half of those who are not working because they are caring for an ill or elderly family member said that had their last employer offered a paid family caregiving leave benefit, they would still be employed today. Likewise, a comparable amount say that they would be much more likely to return to work if a future employer offered them that benefit. Lastly, for those who are not working mainly because they have a personal health condition that's preventing them from working, a third say that if a previous employer had offered them a paid personal medical leave benefit, like temporary disability insurance, they would still be employed today. And then a similar amount said that if a future employer offered them that benefit, they'd be much more likely to return to work. So paid family and medical leave provides a number of really important benefits for the health and development of children. And at the same time, it can be a really important tool to help grow the economy by supporting labor force participation among prime age adults. And with that, I'll turn it over to Dr. Susskind.
Thank you all so much for having me. It's so much more open than the operating room. So it's a real pleasure. So you can hear me all right? So my name is Dana Susskind, and as mentioned, I am a doctor. So I'm going to give you sort of the lens into this issue through the lens of healthy brain development. So forgive me, I'm going to give you a little bit of a science lesson, but hopefully it'll give you the ammunition to understanding why this issue is so robust, so important, and everything about our country is inexplicably linked through what is happening right here. So I want to share the first and most important aspect of my learnings in the many years that I've been doing this, and I have been doing this way too long, that I've discovered that the key to early childhood, that the potential of all children is absolutely dependent on the support for their parents and mothers. So I want to share a little bit of my background, not to teach you how to do surgery, but to give you a little bit of a lens into it. So my origin story is that I specialize in giving deaf children cochlear implants, helping them access sound, hearing, and language. And I chose this area because of my fascination with the human brain. People often think about hearing is all about the ears, but it's really about their brains. And for me, that became extremely clear early on in my practice, when I started seeing dramatically different outcomes amongst my patients. So some of my patients would excel developmentally, others not at all. Some would learn to talk, others not. And compelled to understand the reasons behind this, and more importantly, what I could do to best help all of my patients. I began a journey far outside the operating room. And I discovered this remarkable body of research that really allowed me to understand how a child's brain is built. So, as most of us know, the human infant comes into this world a bit underdone. Newborns can't hold up their heads for the first few weeks. Eating takes a good year or so. And, infants are essentially helpless. They rely on all of us, especially mothers and fathers, to help meet their needs. And humans are fairly unique in this way. After all, when you think about it, a horse fowl can stand within hours of being given birth. A chimpanzee can hold on to their moms as she goes from tree limb to tree limb. And a little newborn, turtle hatched can find its way to the sea within hours. But not our little humans. They are pretty underdone. And I know some of us wish to say, why can't you be more like that sea turtle? But there is a reason. It is the origins of why we are such an incredible species. And the reasons being is that our human brain only comes out about a third of the size of the adult size, unlike those other animals that are almost adult size. And it's because our brains are waiting for the crucial input and instruction guide to finish up the wiring. Because if our human brains were adult size, none of us mothers would ever have children. Because the brains are so big. And so most of that brain growth happens during the first few years of life. The development that happens during these early years is breathtaking. Some 1 million new neural connections happen every second. And the brain grows from a third of the size up to 85% of the adult size in the early years. So it is incredibly important. And the neuroplasticity that underlies it allows the brain to make new neural connections is at its peak during this period. And the connections that are formed during this period are what will allow a child all their thinking, growing, feeling, being that they rely on for the rest of their lives. So these first few years of life, as all of you all have probably heard over and over again, are incredibly important. And remarkably, neuroscience is pretty clear on what a child needs to capitalize on it. What babies need is rich, nurturing conversation and protection from toxic stress. The rich, nurturing conversation is often called serve and return. It's that back and forth that people sort of blow off. It is truly wiring up the brain. And it's powerful enough to give children two critical skills. One is that cognitive skills that we often talk about, reading and writing, arithmetic. And then non-cognitive skills, the social skills like grit and resilience. In other words, nurturing talk and interaction builds the entire brain. It's not just about vocabulary. And just like milk feeds the body, I like to say nurturing interaction feeds the entire brain. So here comes the neuroscience. I won't give you a test after this, I promise. So you may ask, well, how do you know it? We hear it all the time. Because of relatively recent advancements in research, and I'm a researcher, cutting-edge research such as from my colleague Rachel Romeo at MIT and Kim Noble at Columbia and other leaders, they've really shown through sort of a combination of language recordings, between parent and child, and sophisticated brain imaging that shows what's happening in the brain, basically have sort of connected how much rich conversation is actually related to how the brain lights up, all that activity that underlies the skill formation that we look at, the skill formation like language development, vocabulary acquisition, socio-emotional. And in fact, there's even some incredibly cool research showing that when a parent and a child, actually a mother and a child in this particular research, really, the baby is learning, the brain waves actually get in sync. It's called neural synchrony. So it could be even you and myself and some of you all are brain syncing right now. We can't see it, but it is a complex, powerful interaction that really underlies so much of why these early years are powerful for building brain development. So the truth is, despite what people say, neuroscience is pretty clear. There are many ways for us to parent a child, right? We always want, you see on social media, it's this way or that way. I'll tell you as an expert in this area, there are many ways to raise a child. But there is only one way to build that child's brain, and that's through nurturing talk and interaction. We know this to be true, but there is such an alarming disconnect between what we know about what children's brains need and what we've actually done to meet those needs. In many ways, we squander this incredible evolutionary gift, a short period of time where we can either set up a child for success by nurturing his or her foundational brain development or not. So for me, I'm just giving you back to my story. Back in 2010, I started a center called the TMW Center for Early Learning in Public Health, where we've been working to help try to remedy this and ensure healthy brain development of all children. We are guided by the brain science, by the fact that nurturing talk and interaction and protection from toxic stress are the key. But I want to be clear that despite that origins, it is and always has been about the power of parents and caregivers my team and I develop evidence-based programs and interventions to show parents and caregivers how the power of talk and interaction builds children's brains. And we've demonstrated through science that all adults, no matter their level of education, wealth, or work, can master the essential techniques for building a child's brain. But the truth is, we cannot ignore the fact that the larger realities of a family's circumstance, their employment, their health, their mental health, their community, play an incredibly important role. Because they either allow for the brain-building power of talk and interaction to occur, or if they limit opportunities, they stifle it like weeds choking off a garden. In truth, it is difficult, if not impossible, for so many parents in this country to raise children in the ways that help optimize healthy brain development, in the ways that they want to. But I am here to tell you, as you already know, that the potential of children depends on support for their parents, for their mothers, for their fathers, for their community. So what does that mean? How can we ensure that parents receive the support? Oh my gosh, I was the one who talked too much, forgive me. To ensure this, I believe that neuroscience can provide a powerful roadmap, a way to approach early childhood through policies and practices. I'd like to say that it's about building a parent nation. That's the title of my second book, although we should really call it a mom nation. So with that, how do we look at it from a framework? Well, I like to say how we think about what children need really aligns with what parents need. And what do children need? They need time, enrichment, and protection. And parents need the same thing. Children need time with responsive caregivers. They need enrichment in the form of talk and interaction, and they need protection from toxic stress that it can impede their healthy brain development. But what does that mean in practice? What does it mean to provide parents with time, enrichment, and protection so that they can be their children's first and most important brain architect? It means protection, like things like paid family and medical leave, so 1 in 4 mothers don't have to go back to work within 2 weeks of giving birth. With regard to enrichment, it means investment in not only parental education, but ensuring that access to high quality, affordable child care that respects those early educators who are brain builders as well. And with regard to protection, there are a whole host of policies, including many that we've heard today, that ensure the health and mental well-being of parents, especially mothers. You know, I happen to think that these policies are obviously important just because parents deserve this, because it is critically important for a nation that truly, you know, is based on family values. But even from the neuroscience, it is so clear that these policies, and if I had more time, I would show you how they are connected to the brain development of children, and that the stress of mothers directly connect to the brain development of children and support of mothers. This one research study by Natalie Brito demonstrated that mothers who had access to 7 weeks of paid leave had children whose brain functioning was supported. And to be clear, that while neuroscience can be an important guide, that we have to be clear that parents are still the ones who are doing the steering. Parents are the captains of their family's ship, manning the helm. The rest of us, society, are here to help support them, their crew in ensuring that all children thrive. Because I believe firmly that if all children of all races, ethnicities, genders are to flourish in this country and participate equally in the economic and civic life, we must support parents and caregivers from day one. And it requires us to not just look at this as some heartwarming, feel-good thing, but as the way we operate, fuel our economy, and elect our officials, and create opportunity. It is the way we grant children the promise of their promise. And with that, thank you very much.